All right, everybody, we're going to test our audio. Can everyone hear us?
Yes.
Yes.
Yeah.
Yep.
Ron, if you can hear us, can you say you can hear us?
I can hear you.
I can hear you.
Sounds good.
They're coming through here. It'll work as long as they can hear us.
So you can hear us?
Yes.
Yes.
Great, thanks. All right, everyone. Good afternoon. We are so pleased to have all of you. We just wanted to let everyone know that this time together is going to be recorded so that we can allow those who are not able to be present with us right now to get filled in on any of our conversation. We are really proud and excited to announce that our first 10 people were just vaccinated for COVID-19 using the Pfizer vaccine. So cause to celebrate this morning. We successfully have started our process of getting our workforce immunized. We don't have a structured agenda, but wanted to be able to, sorry, just reminding people to mute if they're not on mute. Wanted to just give an overview of our approach to vaccinations for COVID-19 and where we are at this time, and then answer whatever questions we can answer. If you have questions, if you could type them into the chat box. Otherwise, if you could keep yourself on mute, that would be very helpful.
Oops, that was me.
Okay, thanks. I'm just checking to see if folks are muted. Looks like they are.
Okay, great.
Okay.
Mike, do you want to kick off and talk a little bit about where we are today?
Sure.
And from a logistical standpoint?
Yeah, so thank you. The logistics have been interesting to say the least over the past few weeks. We've been tracking it pretty much daily, and the information has been coming out in fits and starts from time to time, and there have been changes along the way, which of course we've all learned the only constant with the pandemic is change and disruption. So the most recent round of that was just yesterday when we needed to rapidly shift our planning from our original timeline that we had built for this week being kickoff week. And so as background, we had planned for our first clinic to be this Friday, and many people were scheduled into that clinic. They still are, so Friday will be our busiest day this week of clinic. And we had anticipated receiving vaccine on Thursday afternoon. So the health department has implemented a model for the Pfizer vaccine to start using a centralized depot. This is because the Pfizer vaccine minimum order size for direct shipping is 975 doses. In order to receive that, you also have to have ultra cold, -80 C storage capability, which Porter does not. Therefore, we were not eligible to be a direct recipient. Instead, us and all hospitals in Vermont except the UVM Medical Center are receiving vaccine allocations from a centralized health department depot. And so our planning was to receive a depot shipment on Thursday for use on Friday. Very early yesterday, we were informed that we would be receiving our first delivery, in fact, yesterday. And it arrived last night around 6 p.m. And correspondingly, we were essentially ordered to activate our clinics beginning today. So there has been quite a bit of activity that was not entirely expected this week to build out a modified clinic schedule that started at noon today. Our overall approach to the vaccination clinic in terms of populating the available slots is anchored at guidance we received from VDH and CDC, and also consistent with the network-wide approach. And it really, my sort of analogy and language I've been using is the sort of common sense tip of the spear. And so the prioritization is built around the recommendations from the ACIP around the phase 1A eligible workers. So these are meant to be patient-facing frontline healthcare workers or those operating in and around those environments. And so we did a prioritization based on sort of risk analysis and likelihood of patient encounters, including people who could be PUIs or COVID positive, whether they know it or not. And so naturally that starts with places like the emergency department, express care, the ARC respiratory clinic, then working down from there into the hospital itself, med-surg unit where they have a history of managing and treating positive COVID patients, anesthesia and respiratory therapists as part of the team that responds to deteriorations of those patients, so forth, down deeper into the organization. Also capturing people in the mobile testing environment and sort of working through from there. In our original clinic vision, it was going to be a Friday and a Monday, and we had been working through a scheduling process, and we've since expanded that. In the Pfizer week 1 allocation we received last night, there are 170 doses to work with, and that's what our allocation was as Porter Medical Center. And so we are doing our very best to match every single dose with a recipient, obviously. Another sort of sub-element of the information we received from the health department back a few weeks ago that informed our planning is they had asked, and all Vermont hospitals had agreed, to also endeavor to vaccinate our healthcare partners locally. And they identified several other eligible populations within phase 1A. Starting with EMS workers. So frontline EMS first responders, whether they be for a first response agency, which might be embedded in a local fire department or a standalone agency, or working for an ambulance service as a paid staffer or a volunteer. Notably, they did not include in this 1A category other types of first responders, including law enforcement or firefighters. So just for reference. And so this week, our aim in our 3 days of scheduling we've done is to prioritize the patients, the Porter departments I already mentioned, and then dig deeper into the organization as our quantities allow, but also include local EMS, starting with the 2 transporting ambulance services of Middlebury and Bristol. And so we have signed individuals from those organizations into our special sessions on Thursday afternoon and Friday afternoon. Looking ahead to next week, just to kind of give you a sense of what's to come, we anticipate hopefully that later this week, perhaps even as early as tomorrow, FDA will issue an emergency use authorization for the Moderna vaccine, the second vaccine we expect to come online in this puzzle. Moderna is a very similar vaccine to the Pfizer vaccine. They're both mRNA-based, kind of techie vaccines, if you will, similar creation methodology, very similar efficacy and overall ratings as a very good, safe vaccine. We anticipate that if that approval comes through by the end of this week, they'll do a similar rapid push nationwide to make Moderna available. A couple things about the Moderna vaccine: it does not require ultra cold storage. It can be kept in either a standard refrigeration environment or a standard kind of pharmacy grade freezer environment. And it has a bit more of a manageable shelf life therefore, and that helps logistics. Another aspect of Moderna vaccine is that it can be directly shipped to us in 100-dose batches. So we will not necessarily look to that Department of Health depot as a sort of intermediary step. So that will also be a useful thing. Our goal will be to hopefully get a good quantity of Moderna to continue working through our vaccination targets within the Porter workforce and then expand out per the mandate to other local community healthcare partners. Examples include other primary care outlets in our community that aren't Porter affiliates, home health, the rest of the EMS workforce, etc. So that's what we're aiming for next week. As we move ahead, we'll also build better scheduling mechanisms for both, hopefully, our employees to utilize through their managers, and also eventually our non-employees, including those groups I mentioned.
A couple of the details just for everyone's frame of reference. So the Pfizer vaccine, both vaccines require 2 doses. The Pfizer vaccine is a 21-day apart between the first dose and the second dose. And the Moderna is a 28 days. So the scheduling of each will be a little different. Additionally, both vaccines, we anticipate some reactions to the second dose is what we anticipate, including mild fever, muscle aches. It does not look exactly like the coronavirus. People don't lose their sense of smell or taste, I do see a question about, does it have to be exactly? So the Pfizer has given a couple of different references. There's some that have said 19 to 23 days. I've then seen other date ranges. The Moderna is what we've heard only is 28 days. That again has not been approved yet, so we'll wait for final answer from the CDC and the FDA after it goes through that process. We are targeting it best we can to 28-day intervals, and we're structuring our clinics. So today, as people are departing their first vaccination clinic, we are making an appointment for their second vaccine. We anticipate, we've been allocated, we understand from the state, but just over 900 doses, or enough vaccine quantity to vaccinate approximately 900 healthcare workers in our local area, and have been working hard to reach out to all of our community partners to understand their numbers and have best points of contact when we're ready to start scheduling. Amy, your question about, will Porter employees who do not work directly with patients have faster access to the vaccine than the general public? Based on the numbers we've received, yes, we do believe that people who are working within our healthcare agencies will, including Porter, will have access to the vaccine prior to other essential workers or the general public.
And so just to follow on that, the phases I mentioned before that VDH is using and consistent with the CDC. So phase 1A, healthcare workers, categorically. At some point that sort of transitions over based on supply to phase 1B. And phase 1B is, some of the details are still being kind of ironed out as to who falls in with that category, but at the least it's been identified to be essential workers. And so how essential workers are defined, Vermont had a particular take on that earlier in the pandemic, and they will re-clarify and restate the expectations around who's in the essential worker category. We also are awaiting more details in collaboration with the Department of Health on who will be responsible for administration of vaccine to the phase 1B and beyond members of the population. And so the Department of Health locally is working on their logistics to stand up special what we call points of distribution, pods. In this case, they would be a mass vaccination clinic to run through eligible citizens potentially within those phase 1B and beyond populations. At some point, of course, we expect to see the vaccines become a part of more routinely accessed medical care and services embedded in all care settings, including Porters. I will take a chance now and an opportunity to mention also Helen Porter. So as a very specific subpopulation, both the staff and the residents at Helen Porter are among the most vulnerable, and they intersect in their vulnerabilities, of course, right? And so the federal government took a very different approach specific to long-term care facilities, which Vermont adopted, starting with skilled nursing facilities, which includes Helen Porter. Under a federally organized contract, large-scale pharmacy chains basically are engaged to do the work directly with long-term care facilities. And so there's a little bit of a potpourri of different ones, but the big players are CVS, Walgreens, and then a partnership between Kinney and Health Direct. Health Direct is actually the contracted pharmacy that Helen Porter uses every day. So it's a part of an existing business relationship we have. Health Direct will be taking on the task of vaccinating Helen Porter residents and Helen Porter staff beginning on next Monday, December 21st.
We also expect that, and we've been in touch with other large facilities in our area like Eastview who have similar partnerships. So they will be vaccinating their healthcare workers and residents in a similar fashion. So, we have been working to populate our first few days of clinic, again, starting with the individuals identified at the highest risk of contracting COVID-19, and are working our way through with managers to populate those schedules. I want to pause and acknowledge that there may be lots of questions about the vaccine, and want to open it up to additional questions. We know that we've heard already among our workforce, there are some concerns about safety, and the timeline which was the vaccine was developed. I think we've been very fortunate with the advances in science to be able to both test. It was large-scale testing in the Pfizer. It's actually 40,000 people participated in that vaccine study, and they have ongoing safety monitoring, and have felt this to be an incredibly safe vaccine. There's abundance of information that we have previously circulated, and the CDC website with up-to-date information is getting updated on an almost hourly basis, it feels like. So one of our asks for all of you is, when the time comes, if you have not already been asked, as for those who are managers, partnering with Mike, Liza, Paul, Brandy, on signing your staff up, and understanding that there's going to be some need for flexibility. And for everyone else, I really encourage you to strongly consider getting the vaccine, as we believe this is one of the paths towards ending the pandemic. There have been questions about testing after, so I'm happy to answer any questions people have, but I'll just echo some that I've heard. One is that, do people get COVID after this vaccine? The answer is no. It's not a live virus. It's a vaccine. It's a mRNA. You may have a syndrome that is flu-like or a viral illness, but you would not be able to get COVID-19 from the vaccine. From a health and safety and workplace, because people may have gotten or been exposed to COVID-19 even before they got the vaccine, if you did develop signs and symptoms of COVID-19, we would expect you to follow the same safety precautions and touch base with your manager and employee health, and would likely be tested based on your symptoms, just as you would now. One other nuance that we've learned is, if people have received any type of vaccine, and the CDC is recommending 2 weeks from your last vaccine until you receive your first COVID-19 vaccine. We've seen this a couple of times with people who just recently received the flu shot. So please keep that in mind as you are scheduling your appointment for the COVID vaccine.
Pregnancy and breastfeeding.
Yeah, pregnancy and breastfeeding. Sure. So pregnancy and breastfeeding. So pregnant women and breastfeeding women were not specifically studied in the initial safety studies. There is no reason to believe that pregnancy or breastfeeding is a contraindication. The vaccine is not passed into breast milk. It is what we're recommending is people who are pregnant have discussions with their healthcare provider about the risks and benefits of getting the vaccine. The Society for Maternal Fetal Medicine and the ACOG, the American Congress of OBGYN, do recommend that especially people who are at high risk of contracting COVID-19, seriously consider receiving the vaccine, because the risk of severe disease in pregnancy could be catastrophic for the woman and her pregnancy. I see that Chris asked a question. The documents we have indicate those with allergic reactions to the ingredients in the vaccine should not get it. What are the ingredients in the vaccine? So there is a long list. The one that seems to be the one of concern is do we have the list here? It's a polyethylene glycol. So it's a very specific alcohol-based derivative. That is, so people who have normal allergies or allergies to antibiotics or food do not need to feel to be excluded. People who do have those allergies though, we are asking them to sit for 30 minutes and be observed rather than the standard 15-minute wait time. And I can circulate that direct question back. I just don't have that at the tip of my fingers right now. Other questions or concerns? We're happy to stay and answer any additional questions, or you can reach out if you.
Yeah, hi, this is Eileen Fuller. We're in private practices, and I just wanted to confirm when, I guess at this point it's probably next week if Moderna gets approved, that, so will you contact our office manager and then we set up individual appointments? Is that how it will work for our office as well?
Yes, yep, we've been in touch with your office several times and have received a full list of your employees and the best contact number. And as we set up the vaccine clinics for next week and the week after, we will be in touch to get you scheduled.
Great, thank you very much. Well, if there are no other questions, we are happy to stay on for a couple more minutes. People can drop off if you don't have questions. But otherwise, we look forward to seeing all of you through the vaccine clinic. Thank you.
Yep.
Thank you.
Yep. For those who have received their first vaccine, is there I can't see the whole thing. Is there? Oh, Val, yes. So what our understanding is that they have, when the orders were placed, they were placed so that we should use the entire first dose and that we would get the second dose as part of the program. So Dr. Unger, I see that you have asked about a list of employees that.
Yes.
Yes, I thought that you had previously done that. If you haven't already given me the names and the numbers, you could send that along to me.
Great. Thank you very much.
Okay. Hearing more typing. I'm not sure if that's for us or for something else. All right, well, hearing no other questions, or seeing no other questions, you know how to reach both me and Mike and Liza, and happy to answer any questions as we go. Otherwise, December 16th, this is the first day we got a vaccine here. Oh, we got another question. So Kelly, that is not the current recommendation to not get the vaccine if you use an EpiPen. So I think if you have specific reasons for that and specific allergies, I think working them through with Liza would be my recommendation. I think that in general, what we're hearing is that was an overstatement, that just having a history of anaphylaxis to anything is not exclusionary for getting the vaccine.
And in the vaccine clinics, obviously, they're prepared to manage an anaphylactic type reaction at the time of administration.
Well, thank you all for taking the time today. I'm going to give everyone 5 minutes back of your day, and please feel free to reach out again if you have any other questions as they come up, and we will try to keep you informed as things continue.
Yeah.
All right.
Thanks, folks. Bye-bye.
She was up there. I missed it, and she knocked it off, and one segment broke.